So hi everyone, welcome to NATCO Studio Room powered by Indian Society of Critical Care Medicine, and today we are being with Dr. Anshuman from Padra Hospital, Delhi, and I'm Anina. I'll be the host of this program, NATCO Studio Room. And by the way, welcome sir, welcome Dr. Anshuman sir for NATCO Studio Room, and I would like to welcome you to share your thoughts with all of us, and it will definitely help our younger generation. And my first question will be, how does ceftazidime avibactam perform in treating hospital acquired pneumonia caused by CRA? Sir, please.
As you know that CRE means catheter related bloodstream infections, and it happens mainly in long stay in the hospitals. When there is antibiogram happens, there is bacteria is internally resistant to some amount of antibiotics. Before that, we should know that as we are using much more of high-end antibiotic, that leads to resistance of the microorganisms. That is why we need better antibiotics, like which can be used for bactericidal of our death of the bacteria in a quicker way. That's why ceftazidime avibactam has appeared in our armamentarium for our bacterial killing. We know that avibactam has a major advantage about our antimicrobial effects with a good results better than existing antibiotics.
Alright, thank you so much sir. And how does ceftazidime avibactam compare to meropenem in treating MDR infection? Sir?
Previously, we know that meropenem is the carbapenem group of antibiotics which are used for our death of our organisms, that is microbacterial infections and much more. Due to repeated use of meropenem, that bacteria becomes internally resistant to our meropenem. That's why if you give meropenem, even if in higher dose, it has a less bactericidal effect. After coming the avibactam, which is more potent with addition of ceftazidime, the it is a better advantage over meropenem. So that we know that our hospital days stay of mortality benefits happens in with ceftazidime avibactam.
All right, thank you. And how does ceftazidime avibactam impact the length of hospital stay for patients with CRA infection?
As you know, our data says that mortality rate is much more in CRE infections. That is catheter related, antibacterial and bacteria enters to our body and leading to septic and septic shock, ARDS and different mortality of the patients. As we know that avibactam with ceftazidime has a advantage over the meropenem by a bacterial death, with around 30 to 40% much more bacterial killing is there. That's why our patient recovers from the septic and septic shock with less of hypotension, leading to our less of organ damage. That's why recovery rate is much more in avibactam and group of patients which receives the avibactam group. And as we know that if a patient stays in the hospital much more days, the mortality rate increases. As in avibactam group, the percentage of stay in hospital is less. That's why patient recovers much early and has a good result and less of mortality in CRE patients. Definitely in India also, in our hospitals also. Thank you.
All right. So thank you so much, Dr. Anshuman, for coming here, and thank you so much for sharing your wisdom with all of us, and it will definitely help our younger generation. And thank you so much sir for coming here, and thank you so much sir for accepting our invitation. Well, we are going to conclude NATCO Studio Room right now. Thank you so much everyone for watching us. Thank you.
Thank you.